What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering some of the tragedies I've seen as fellow people who are coming into our profession, as far as like how the way you get treated, especially as a student or even as a brand new tech who's coming into the workforce. I've talked to many veteran techs and some of the newer techs and even some of the students. I personally had an amazing experience. There's certain sites that were maybe not as good, but the majority, it was amazing. I loved it. I loved clinicals. It was like the best part of the whole X-ray school versus a bunch of the other students maybe didn't have a good experience. Maybe certain techs even that I work with today, they told me as a student, like some of the techs they were under, it did not go good. And then we have one of the techs I currently work with was telling me how they didn't enjoy any of it and they were almost going to give up on the profession until even the beginning, like even like their first jobs, like it was terrible. And I was like thinking, I'm like, dang, I was so fortunate enough to have amazing people take me under the wing, educate me, and I become an amazing tech. Like I look at it, and even some of the techs now, they're like, well, Miguel, all these other places here local are not the best. Like I've been to X amount of hospitals hereby. This was like the best place. And I'm like, well, dang, I got so fortunate that my first job I worked at is going to be like somewhere that everyone else surrounding areas wants to be at. And I'm like, well, why would I kind of want to leave? Like it's a good gig. And I mean, even talking to some of the techs, like they would tell me how maybe they didn't get it treated good, or a bunch of like the veteran techs when they were trying to learn were like really mean to them, or certain job sites you were just terribly managed and like you just got too much chaos or toxic environment. And I'm like, dang, I was fortunate enough to not have to be around any of that. I mean, I had a few sites that were maybe not the most student friendly, but like you could still get your comps as long as you were trying and you were on top of your stuff. Because like not every single tech out here likes students, because you're still learning. Not everyone's a teacher. Like certain techs, like you'll quickly pick up that are more nicer or willing to help or willing to, because at the end of the day, we were all at the same position that you were in. Like maybe I've been there sooner because I mean I've just barely been out, so I'm always nice to students because I know what it's like to be under stress and to be dealing with a bunch of stuff. It all kind of depends on who's the techs. Certain sites just are more lenient to students. You'll see when you're going through the program, and you can kind of pick and choose who you should kind of follow and learn and educate and stuff like that. I was fortunate enough to have like amazing people, and which made me amazing techs. So I would just be careful when you go out to the actual workforce, because they always try to take advantage of you, especially pay. They always lowball you, always try to negotiate for higher. And maybe like a bunch of even people that I went to school with told me like their first job they went at was like not the best job, but sometimes all you have to do is just get that experience, because that is what most places want. It's the hardest thing, is always the getting into the place and getting some experience. And then once you have that, you can kind of dabble in whatever else you want to do. Especially if you want to do traveling, you can kind of, you need a cinematic like trauma 1 or trauma 2 experience before you can go out and they'll hire you. So sometimes you just may have to suck it up a little bit and go through a few months or even a year, and then just kind of bounce to a different place if that's what it is. It's not always easy, but I mean I was fortunate enough to have a good. I'm not here like flexing on anyone or doing like that. I was just saying that it can be wonderful. I mean, I have like one of the techs I work with at night told me how like it's been like their like past 4 jobs have been terrible, and they came in here and they saw like a complete 180 and gave them hope of continuing to do this field. They're like, Miguel, I worked in places where the manager was like super mean, or they didn't know nothing about our field, or like all this stuff. I'm like, I'm come here to your job. Like our manager's cool. Like the workflow is very well balanced. You get shit done. Like it's good. Like it's too good. Like I was like, I don't know what to tell you. Like you just, when you find a place and you get into rhythm, like it should be good. I mean, obviously anywhere you work at, there might be like a little window where you're still trying to get, like you're trying to like understand what the orders, the workflow, how to best work with the other techs, and get the balance of the rhythm of it. But then eventually it should become smoother. Like at this point, I'm just on cruise control, just knocking out stuff, coming in, doing what I gotta do. And you understand the environment. And maybe as a student, since you're new and you don't know, like it's a different beast comparing to other fields. Like maybe you had a bunch of work experience in other fields, but the medical field itself has its own little world. Because you're mixed with very educated people, and you have to act a certain way, you have to behave different, because we are both in the hospitality industry and we are helping people that are in need. So it's a little bit different, which I'm fortunate enough that I enjoy it all, and I don't think anyone should just give up because maybe their clinical wasn't good or their first job wasn't good. You should give it a shot and look elsewhere if you're not happy. And yeah, it's been your boy Miguel. See you on the next one.